Alex, thank you for joining me today.
My pleasure.
Can you tell me a little bit about yourself and where you're from?
I am a neurologist at Boston Children's Hospital, and I'm co-founder of GABRA Neuroscience.
Amazing. Now, your work with the GABA A variants, what exactly do you do?
Right now, what we're doing is research. We are developing gene therapies for a series of rare diseases that affect GABA signaling. What we're doing now is research in mice, research in cells, research with molecules, but this is for purpose of eventually making this research into treatments that we can deploy among our patient communities.
For someone that is newly diagnosed with a GABA A variant of sorts, and they may not know what gene therapy is, how would you describe it to them?
This has been an old idea, but it's recently available to us as a tool in epilepsy. And the concept of gene therapy is that we either replace a gene that's abnormal or absent, or we add a gene that would be helpful to a patient, or if there is a gene whose expression is providing symptoms to the patient, we suppress that gene. But ultimately, we're modifying the expression of genes in patients to relieve their symptoms.
Is there any sort of timeline that you can speak on when this may be available, or you may be projecting it to be available?
Some forms of gene therapy are already available. There are FDA-cleared products for treatments of neuromuscular disease, for example. The specific therapies we're working on are in the preclinical stage, and we're cautiously optimistic that we can be in clinical stages in the next couple of years.
How can someone inquire about your clinical stages when they come about?
We're very easy to find. Google our names, email us.
Perfect. And your work with Cure GABA A, how are you integrated with their work?
We're very directly related. So the fact is that Cure GABA A has sponsored some of our research. We are very committed to this community of patients, and we're developing therapy specifically to address the needs of this patient community.
Wow. And so I would assume that means that we can expect to see you in 2026 in Denver at the conference next year?
I'll be there.
Perfect. Well, is there anything else that you want anyone that may be newly diagnosed going through the journey right now to know about what you're researching?
Well, not just me, but all of our colleagues in the field of gene therapy and in the development of new therapeutics in epilepsy. I guess if there's a message to everybody, it's that the bottom doesn't drop out. There are therapies now that were only thoughts just in recent years. And these are very real opportunities now to help patients in ways that weren't possible before. And like any other technology, gene therapy is getting better and cheaper every year. And so we expect these advances to be accelerating so that if we have only a few therapies now, we'll have several next year. And if we have several next year, we'll have many more in the years to come. And so we are cautiously optimistic that this is a line of work that will be very productive, foremost for patients, but also for investigators and the communities of physicians.
That's amazing, Alex. I appreciate all of your work in this field, and I appreciate your time today.
Got it. Happy to help.
Thank you.